Good morning. Our news conference will start in just a moment. Good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. Today's panelists are Director of Public Health, Catherine Wells, Jessup Bretz Hill, a nurse with Lubbock ISD, Christy Rose, a nurse with Lubbock Cooper ISD, and Hannah Deal, a nurse with Friendship ISD, and Mayor Dan Pope. So let's get started with Catherine Wells.
Good morning, everyone. It's great to be here. Thank you for that introduction, Lacey. And I'm really excited to have our school nurses here on the press conference today. They are really our behind the scenes contacts with our school districts. And it's really great to be able to highlight some of the work that we're doing. Today, I want to talk about booster doses, our city plan for offering booster doses, and also talk a little bit about the infusion process. So to start off, the FDA and the CDC authorized booster doses last week. And just so everybody's clear, a booster dose is an additional dose of a vaccine that's given after your original series to give some additional protection or immunity after you get that first dose of vaccine. This is typical with a lot of vaccines. We receive a tetanus shot every 10 years. That's because that immunity wanes. We also get a flu shot every year because that immunity wanes. So it's very typical for vaccines to have booster doses. There are some specifics about the booster dose that was approved last week. The first one is that booster doses are only approved for individuals that got the Pfizer vaccine. We expect that to change, but right now we can only give boosters to those who had Pfizer vaccine. There's also some categories of individuals who are eligible. You have to be 65 years or older, or be 18 and older with an underlying medical condition. And there's a whole list on the CDC website of those underlying conditions, but some of the common ones are cancer, chronic kidney disease, COPD, diabetes, or dementia. Those are all qualifiers to get this booster dose. Also, individuals 18 and over in a high-risk population or high-risk occupation are eligible for a booster dose. So this includes our first responders, fire, EMS, police. It also includes our teachers and daycare workers, manufacturing, postal service, and even grocery store workers. So anybody that really has a lot of exposure to the community are eligible to get this booster dose. And then the last group are those who live in a high-risk environment who are 18 and over, such as individuals that might be under 65 in a nursing home or individuals in a correctional facility. I want to make sure that people understand that booster doses are different than the third dose. The third dose of vaccine is eligible for both Moderna and Pfizer, and that's only eligible for people with very specific high-risk categories. And if you think you qualify for that third dose, please talk to your doctor. The health department's excited to announce that starting October 6th, we will be operating a mini vaccine hub at the Caprock Shopping Center, and this is located at 50th in Boston. And the hours of operation will be announced next week, but we will be moving all of our vaccine operations to this standing storefront location. And at that location, we're going to be able to give booster doses. When they open up vaccine to children 5 and up, we'll be able to service that group. We'll be offering flu shots if you're uninsured. We'll also be offering children's vaccines at that clinic. We're really excited to be able to have that extra space, and this will allow us to serve the community for the Pfizer boosters, and then anticipate seeing some other boosters coming on board. So we will definitely have that space and staff there to operate that clinic. And then I also just wanted to mention, to make sure that everybody understands, there's been a lot in the news about infusions and possibly not having enough infusion medication. The infusion is the application of a medication after you've been exposed to COVID or early on in developing COVID. We have our infusion site up at still available here in Lubbock, and it is serving, on average 70 to 80 people a day. And if you have any questions about getting that infusion, please call the health department. Either your doctor can refer you or we can help you get access to that site. With that, I want to pass this over to some of our school nurses. We're going to start with Jessup Bretz Hill from Lubbock Independent School District.
Thank you, Catherine. So my name is Jessup Bretz Hill. I'm the school nurse with Lubbock ISD, and I've also worked with the health department doing contact tracing, and I've worked at a lot of the vaccination clinics at the Civic Center and some of the pop-up clinics. So this is my 5th year as a school nurse with LISD, and I have to say that never in my life would I have imagined that I was a school nurse working from home like I was back in March of last year when the pandemic first started. But we got through it and we're back in school now. So I just wanted to start out talking about my own personal research and thoughts that people ask me my opinions on that. And I always tell them I was a little skeptical at first with the vaccine. But I did some research and I learned, that the technology for this vaccine has been around for years. Scientists have been working on this technology for many, many years. So it's not an entirely new thing. And people ask about the side effects. Considering the side effects of the vaccine itself leaves your body pretty quickly. So after a short period of time, there's really no vaccine left in your body. It's just the antibodies that your body creates that stick around. So it's not a live virus. It's not going to give you COVID. It just simply tells your body to make the antibodies. So once your body makes these antibodies, it kind of just destroys the vaccine and flushes it from your system. And it leaves the antibodies and that's what provides you the protection. So it's been over a year since the vaccine was first administered to the participants in the study. And in the US, there's been more than 390 million doses of the vaccine given. And it's been found that the side effects are very, very rare. And in fact, there's not even a whole lot of them reported. Another big question that I get is the effectiveness of the vaccine. So as a school nurse, I've seen several students with COVID and staff as well. However, of the staff members that are vaccinated, there's been very few test positive for COVID. So even with myself, I'm vaccinated and I see sick kids and sick staff all day, every day. I have multiple direct exposures of COVID when I'm testing students and staff in my office. I have students in here waiting, for 30 minutes to an hour at a time, sometimes, excuse me, for parents to pick them up. And they're sick and symptomatic. And, knock on wood, I have been protected because of my vaccine. I know as parents also, when your kids are sick, all you want to do is love on them and hug on them. And that's what a parent should do. But it's hard to quarantine a child or quarantine yourself as a parent when you're sick, when you have children to take care of. And so kind of what in my practice this year, I've seen that most of the time parents that are vaccinated and have children sick with COVID, they usually don't test positive. It's been very, very rare that I've seen a parent that's vaccinated test positive with their kids. And, they're at home laying in bed with their kids, holding on to their kids, snuggling up with them because that's what parents should do. But their vaccine protects them. So on the flip side, if you as a parent are fully vaccinated and you're exposed, completely vaccinated and you're exposed, you don't have to quarantine per the CDC guidelines. That's a wonderful, because one, it's hard to quarantine as a parent, and two, the vaccine hopefully prevents you from becoming ill after your exposure. And therefore it lessens the chances that you're going to pass it on to the young children or family members and friends that are not able to be vaccinated. So I just want to use this example really quickly. I'm sure some of you, excuse me, have probably heard of it or seen it before, but I like this. It's a Swiss cheese example. I really like this analogy because it shows how all of these measures in the vaccine works together. So for the past year and a half, we've been talking about preaching. We've been preaching hand washing and sanitizing often. So if you look at this first piece of Swiss cheese, you can see that hand washing and sanitizing alone helps out some, but it still leaves some holes. So if you add face masks and social distancing to the hand washing, it covers up some of those holes, but it's not perfect. There's still a few holes. Now we have the vaccine. So if we can add the vaccine on top of the other measures, it pretty much covers up all the holes, right? So the point of this example is all these interventions work well, but alone, they're not 100% effective. But if you add them all together and you get the vaccine, it works. So remember, you're not considered fully vaccinated until 2 weeks after your second dose. So it's important to continue the hand washing and sanitizing and all these masks and social distancing when we can. The vaccine's safe and it's effective. It not only protects you, but it protects your kids, your family members, and your friends that aren't able to get vaccinated. So I highly encourage everyone that is able to get that vaccine as soon as you can. And with that, I'm going to turn it over to Ms. Christy Rose, the Director of Health Services at Lubbock Cooper School District.
Thank you, Jessup. I agree with everything you just said. I also kind of want to add, for you families at home, and you may be wondering what your school nurse does. So our main goal as a school nurse is to keep sick kids out and healthy kids in, right? We really want healthy kids learning. And we know from research that that's really where kids need to be, right? With each other, support from the teacher and the community. So, we are blessed to have a school nurse on every campus and to support parents and students. Our biggest, I think, support with the school nurses has been testing. So all of our campuses test for COVID-19, and that is very helpful. We can, if we have a sick kid that comes in and with parent permission, they meet the guidelines maybe for potential COVID, so we can scan them right then, rapid test, and see if we need to get the sick kid out, right, and support the families or allow the healthy kid to go back to school. So that has been a blessing. We also have promoted vaccines, just like Jessup was saying. We've had several clinics for our administration, for our staff, for the community, and now for students. And so we're partnering with United, and we have a great partnership. We've always partnered with them for flu shots. And so now we get to utilize COVID-19 as well. And so with our flu shots coming up, we have a bunch of harvest festivals that we will provide COVID and flu shots to parents and the students that qualify for that. Most of our staff are vaccinated, and we have really seen them a lot less with COVID-19 this year. So they have been healthier this year with our vaccines, and we have really seen that in the classroom. That's been a blessing. Of course, we've continued, and I'm sure all the schools have, with enhanced cleaning. Our custodial staff, they're amazing. We have a quick response for cleaning, and so that way we can sanitize those rooms. And so we work with each campus. Each campus has a great staff that will do that, especially overnight, that deep cleaning. And then, I just really think it takes a community. The school nurses have gone above and beyond testing students and even sometimes family members that can't get testing. They can kind of a drive-up service. I know that sometimes it's hard to get in to the doctor, or they just want to know, for sometimes just anxiety purposes, and rule that out. So we've been able to do that with them. And I think as long as we can continue this support, we can definitely get through this as a community. I guess after that, we'll hand it off to Hannah Deal with Friendship ISD. She's an elementary school nurse and also the head nurse over there.
Hi guys, my name is Hannah Deal. I work with Friendship, and I've been here for 13 years and loving it. I'm at Bennett Elementary. Go Tigers. We have 14 campuses at Friendship, and we have over 10,800 students across our district and over 1,300 staff. So over the district-wide, we've been doing really well with COVID. It's not just COVID present in the schools. We've had flu and strep throat and just regular respiratory illnesses and ear infections. And so we do have COVID, but there's been just the normal building your immune system, going back to school that we've seen here, especially at the elementary level. Those little ones, they're learning to wash their hands. So we've been doing lots and lots of teaching on just standard precautions of hand washing and covering your coughs and sneezes. And district-wide, we have signs up just, in hand washing stations and our morning announcements teaching kids how to do that. We've been encouraging our visitors and our parents and staff and students to just screen themselves, do that pre-screening for COVID symptoms before you walk in the building for school or to bring your kid their lunch. Just trying to do all we can to keep kids safe. Like Christy said, our job as nurses are to keep the sick kids home and the well kids at school. And so we've been very busy trying to assess all those little ones and big kids and just try to send those kids to the doctor that need to go. We have seen COVID in the schools with adults and children. With kids, it has not been as severe as you would see in adults last year. They have a short recovery time. I've noticed that within that 10-day time frame, they are bouncing back and they're ready to go to class. Common signs and symptoms that I've seen with kids are it presents kind of like a sinus cold. They've had a headache, a stomach ache, some fever. Some have had a scratchy throat, some cough, congestion, just sinus drainage. No cases have been severe. And parents have done a really good job at screening their children every day and taking them to their doctors and getting recommendations from their physician. If you ever have any questions on how many cases Friendship has, you can always refer to our Friendship. We have the COVID dashboard on our website, and that's updated daily for our community and our parents to stay up to date with COVID cases district-wide for Lubbock, for Friendship. Just standard precautions for parents to be aware of, just for any year really, is to, if your child has the fever and the diarrhea and vomiting, we have that 24-hour free rule that has been in place for years, to sort of screen your kids before school and make sure they're well enough to come. TEA, they require us to have, if a student or staff are positive, we do have to exclude them from school, but we are following with our primary care on that return date and just working with our physicians and our Lubbock community on getting our kids and staff safely back to school. We're just, the standard precautions, we're just really working on the teaching the kids on hand washing and stuff. My grandmother taught me, well, wash your hands before you eat. So we're just really trying to educate kids and parents. If you make sure you're keeping your kids hydrated and rested and taking their vitamins, and just try to help them keep their immune system strong as they go to school. Flu shots, we've got that offered for our Friendship staff coming up, with working with United as well. And then COVID vaccines, they're not required for Friendship, but that's a family decision that we're leaving up to families to make for themselves. Masking is optional for everyone. They just need to do what their family feels like they need to do to stay safe and protected. And then as a school nurse, we're just trying to do our best to take care of everybody that comes in, whether an adult or child, and navigate through every illness or injury that comes in the office, and just try to help the parents that are calling that have been exposed or dealing with COVID in their families, and just trying to be that person that they can call for help and questions and concerns, and just be somebody for them to help support them through that process, and just kind of help our families with whatever needs that they have. It's been very challenging for lots of parents and navigating through this with family loss and illness for a couple of years now. So we're just trying to be supportive for them. So that's all I have. Thanks for having us. I'm going to turn it over to Mayor Dan Pope.
Thanks, Hannah. Good morning, everyone. It's great to be with you. I want to start by sharing a few data slides before I make some comments. Okay. Didn't move it up to the beginning. Okay, so let's start with our hospitalization rate. This is one that our citizens and media partners will recognize. You see the progress that we've been making over the last 10 days or so. We still have a long way to go, but the trend on this is very positive. This is our case count by age over the last 14 days. Just to do a little deeper dive. Last week, our average number of new cases went down 20% versus the week prior. So trends going the right way. You can see the distribution is pretty similar if you've been following this data. Finally, the slide that I want to maybe spend the most time on, this is percentage of residents with at least one dose of the vaccine. You can see significant improvement here. I would point your attention to 12 to 30-year-olds, even though those bars aren't as high as we'd like them to be. That's where we've made the most progress in the last month. But overall, there continues to be a good uptake of vaccination. Our clinic, we were effectively doing about 5,000 doses a week. That's dropped off a little bit. We don't know, because you can get a vaccine so many places. It's hard to say what exactly is going on total, but the trend is very positive, and I'll talk more about vaccinations in a moment. Okay. I want to start by expressing my thank you and my empathy. First of all, thank you to all of you and your perseverance. Your families, your businesses, your churches, thanks for all you're doing to work our way through this pandemic. I also want to pause and acknowledge those of us who have lost loved ones and friends, or maybe someone we work with. It's significant, and it's I want you to know that those losses are heartfelt. I'm so thankful for our partners. I want to thank Jessup and Hannah and Christy for their help today. They are emblematic of the kind of support we've had throughout this pandemic. Our school districts, our universities, our business community, our hospitals front and center. They've been great partners. The state's a great partner. The county's a great partner. We've done this together. I think that collaboration has allowed us to safely navigate our way through COVID-19. So my message today is one that you've heard before, but let me reiterate. Things are better, but we need to stay the course. We are improving. The vaccine is safe and effective. Jessup did a really nice job talking about that earlier. You can get a vaccine most anywhere. Our supermarkets, at your pharmacies, at your clinics. The school districts talked about the pop-up clinics they're running. If you go to the fair between now and the end of the week, when the fair ends, we're giving free vaccines at the fair, and you get tickets to go rides in the Midway. So that's a double banger right there. Okay, go to the fair, get a vaccine. We'll continue to do pop-up vaccination clinics. Catherine talked about our new mini clinic on 50th Street that will open on October 6th, next week. That's exciting. That will be a great opportunity to not only get COVID vaccines, but also the flu vaccine. We also are aggressively working with partners to make sure that our infusions, our infusion therapy is available. We actually sort of one of the leaders in the state in this effort. And, if you are positive, you need to talk to your doctor about getting that infusion therapeutic. If you don't have a physician, call the health department. We will help you out. That's all I have to say. I'm thankful for all of you. Let's continue to make good decisions, keep ourselves and our families safe. Back to you, Lacey.
Thank you, Mayor, and thank you to our panelists. We have everybody turn on their cameras and we'll open it up for media questions. Today's media question order is KMAC, KCBD, KLBK, Latino Lubbock, The Daily Toreador, Texas Tech Public Media, and El Editor. So let's start with Katie Gray with KMAC.
Can you hear me?
Yes.
Yes. Okay. First of all, I just want to thank all of you for speaking and being here today. So thank you very much. Really appreciate it. So my first question I'm going to start out with is Pfizer has requested approval from the FDA to give their vaccines to school-age kids 5 to 11 years old. If this is approved by the FDA, will local school, elementary and middle schools hold vaccination clinics on campus for students?
Catherine, you want to address that?
Yeah, I'll start off. Just like we did when they opened up vaccines for 12 and older, all of our school districts either partnered with the health department or United or another pharmacy to offer vaccines to children. And the two ways we can do that is offering vaccine after school, because they do require a parent permission, or we've also worked and had parents send home permission slips and the school nurses administering the vaccine during the school day. And the goal with everybody is to get those children vaccinated as soon as possible when that's open.
Okay, thank you. So my second question, still related to it, is do you see the COVID vaccines as a requirement or mandatory immunization like the MMR vaccines in our schools in the future?
I think that's a decision that likely is to be made above our pay grade. We're still learning a lot about COVID, and we, over time, as we know more about it, that might evolve. But today, I don't see that being the case.
Well, thank you so much for answering.
Thanks.
Okay, now we move on to Karen McKay with KCBD.
Good morning.
Morning,
Here.
Karen.
Can you hear me?
Yes.
Isn't it great you can hear me this time? First try. I'm hearing some people are already getting a booster shot for the Moderna. So where are they getting those, and what do you have to do to show that you are eligible or high risk? You listed a lot of things that would qualify, Catherine, but can you just go up and just say, I want one?
Yes, the guidance from the state is to allow people to self-declare that they are eligible for that booster shot, and providers and pharmacies and the health department are offering that vaccine.
And also I want to ask, when are parents asked to keep their kids at home from school? For sure if they have a fever, but what if they have a runny nose and they're lethargic? I mean, can you explain, Hannah, you mentioned, screen your child before school, but what exactly does the screening include to leave them at home?
Hannah, you want to answer that one?
Yeah. For our district policy, if a child has a temperature of 100.0 or higher, we call that a fever. And if they have the fever, if they've been vomiting or have diarrhea, then they have to, be 24 hours free of that. If it's just a runny nose and there's no known exposures to COVID, then, they do come to school. If they, the parents, maybe that kid has allergies. It is West Texas, and we're seeing a lot of just allergies for seasonal right now. But we're just asking parents, like, if they maybe those allergies, and what if they have body aches or the sore throat, and we've got strep throat going around as well. And so these parents are just giving us a call, and that maybe they're sending them to the nurse's office, and we're having to assess them. If it looks more than just like the sniffles or allergies, then I'm calling the parents and saying, hey, you might need to make an appointment with your doctor and get them checked out. And then those physicians do what they need to do. And maybe they test them for COVID or flu or strep, or maybe they have to prescribe some other medications. But a lot of parents are just calling us if they have any questions or concerns. And then they're coming to the nurse's office, and we're trying to quickly assess them and call the parents and let them know what we see as soon as we can, to be safe and help them out.
All right, thank you, Hannah. I'm sure that's helpful to a lot of parents.
Yeah.
Okay, thank you. Now we move on to Skylar Soto with KOBK.
Hello, everyone. So my first question I'm going to start off with is, what has been the biggest challenge or frustration for you as a nurse so far this school year?
Christy, why don't you take that one?
Well, it's hard when our kids are out for 10 days, they feel better and they're ready to come back. So that has been a challenge. And we definitely, with those positive cases, we want to keep them out the 10 days. So, also, I think sometimes we don't want positive or potentially sick children into the school. So that's why we try to test them and have them drive up in their car, and we'll run out to their car and test them, because we don't want, to expose the rest of the staff or students. So it is hard to get to identify kids with COVID-19. And sometimes I say, I'm sorry you feel bad. It's not COVID, because we can test in the clinic with parent permission. Your throat looks okay. You don't have a fever. You're just going to have to go back. And so I know kids have a lot of anxiety over it too. And so just to really support them and work with the families, we want them in school learning if they're healthy and able to learn. But if, like with the previous question, if a student can't stay in class, if they are lethargic or they can't learn, we definitely need to get them home and get them to rest. And there are other things other than COVID-19, but that's just our main focus. And I know sometimes that's frustrating.
Thank you. My next question would be, the numbers in Lubbock continue to decrease, which is great news, but it seems our deaths are not really going down at the same time. Could you talk about the death rates in Lubbock, and have there been any COVID deaths from vaccinated residents?
I'll talk about I think I can answer both of those questions. So you're going to see what we see with deaths, unfortunately, is they're a sort of a trailing data. So because of the length of time someone is sick with COVID, even though we see new cases going down, we still have a lot of people that are sick, and therefore you see maybe a disproportionate number of deaths. We saw this, we've seen this with the two other big waves we've had. So it's something that we have come to expect. Catherine will have to confirm. I think we've had one maybe case of a vaccinated person that died, and they had a number of underlying health conditions and were elderly. That's been a while. Catherine, can you confirm that?
Yeah, there's been a few deaths of individuals that are vaccinated. They tend to be, for the majority of them, they're all older. And that's why one reason I'm so excited to see these boosters is because they probably had waning immunity. These boosters are going to be eligible for everybody over 65, and we'll be able to increase that immunity longer.
And remember that 80% of the deaths in the country are from COVID or from people over 65 and over. And so that's why we're so focused on that part of our population.
Thank you so much.
Thank you, Skylar. Now we go to Christy Martinez Garcia with Latino Lubbock.
Happy fall, y'all.
Thanks,
I've
Christy.
always wanted to say that. Anyways, thank you to the nurses. I know you guys are the frontline people and you've done a great job. But I do want to focus a little bit on the teachers because a teacher is not quite the same as a child. How are you managing that? And I know that a lot of the teachers have to go home to heal. So how has that process been handled? Are you testing them? What's the process?
Jessup, you want to talk about that one?
Sure. So with Lubbock ISD, we also offer the testing to staff and teachers. So if a teacher is symptomatic and they feel that they want to test, they're welcome to come down. We have testing on all campuses in Lubbock ISD as well, so they can make an appointment with any of the nurses to get a rapid test. And same with the children. If they are positive, they are required to quarantine for 10 days. Exposures kind of varies, just depends on the person with their vaccination status, things like that. But we are offering that to teachers and staff as well.
Awesome. Catherine, I have another question, and maybe some of the others can also give a little bit of insight, but we're seeing an increase, and even one of the nurses mentioned how the children have a little bit of COVID anxiety. They're afraid to get COVID. How is that attitude? I know you've got a lot of folks that are coming in and they've resisted because of that anxiety, but how are you managing that? And also, I do need to ask, what are the hours of this new clinic that you're going to have?
The hours, we're still working on the specifics and looking at the demand. We're going to start off with probably every other Saturday operation with some daytime hours. As soon as additional boosters are available, that will be expanded. And I will put out a press release with the specific hours of that hub site. As far as anxiety, it's real. I've told you all multiple times that, I'm mom and I have a child that's not vaccinated, and, she gets anxious about school. She hears probably a lot more about COVID than the average kid talking at our dinner table. But it's real. And I think we just need to address, with children that, this is a scary time, but adults are around to protect them. Adults are getting vaccinated to protect them. But it's important for them to be in school. And that's what we talk about at our house. I don't know if any of the other nurses want to chime in there.
Christy, you want to add to that? Anything?
Maybe. Oh,
okay.
Well, I think that having a school nurse on your campus and being able to educate students, and hopefully we've always pushed hand washing, and we've had a lot of different programs come through to talk about hand washing, cover your cough. And I know a lot of the anxiety comes in when someone maybe across from you is coughing, or, they may want to wear a mask. And there are several students who wear a mask and teachers that wear a mask in the classroom. And I think so they should be accepted for doing those things. Lots of hand sanitizer, scheduled hand washing. I think just support in general helps with that. And just reassuring them that, we don't really see a whole lot of spread in the classroom, right? When you're sitting in the desk and learning and doing what you should be doing, we're not seeing the spread like maybe potentially other places where you're interacting more, like at home where it's more intimate. So I think they should feel confident coming to school and trusting that the adults are taking care of them.
Okay, thank you, Christy, for your questions. Now move on to the Daily Toreador and Toluwani Osibamowo. I hope I got that right.
Hi, good morning, everyone. Can you hear me?
Yes.
Yeah.
Okay, awesome. Thank you all so much for sharing all this information with us. In the data that Mayor Pope showed, we saw that some of the biggest cases happening over the past week have been in that 18 to 25 age group, which fits pretty neatly into college age students. And, we're not elementary school or middle school students where we have, all of these people kind of watching us and making sure that we're not sick. It's more about personal responsibility with these adult students. So even though we're not getting in hospitals and dying at the same rate as other demographics, people are still getting sick and spreading the sickness across the campus. So is a booster still enough? Is all of these precautions still enough to protect students who are going to their classes and to these events and still getting sick?
Do you want?
Catherine, you want to answer that one?
Yeah. We've spent a lot of time today talking about boosters, but it's still key for these demographics to get their first vaccine. Vaccine slows the spread. It reduces the likelihood of hospitalization. It reduces the likelihood of transmitting it to others. So anyone in these younger demographics that's eligible for the vaccine, they still need to get vaccinated. That's the first message that we need to get out to these groups.
Okay,
Thank you so much.
thank you. Now move on to Sarah Self-Walbrook with Texas Tech Public Media.
Hi, everyone. I just have one quick question for our school nurses. I'm curious to know, Christy, you touched on this just a second ago, but how has spread in classrooms this year compared to spread last year during the pandemic?
Christy, once you start, Christy, we'll hear from, we'll go ahead and hear from Hannah and Jessup on this briefly also. Okay.
Okay, I would say that both years have been pretty minimal. You know, there have been some isolated cases where we have seen some spread in the classroom. You know, we have been working with the health department. We have I think each of us have a liaison that we work with on what is best to do with those classrooms and how to move forward. But you know, really we'll see maybe one in a classroom and then we'll monitor the rest for symptoms, or we'll call and ask the parents to help us monitor. So that really helps with the parents' help. And a lot of them will choose for us to test them to just rule out COVID. You know, they've had a cough and I'm nervous it is COVID. Will you test my child? And of course we will do that for them. And then they know for sure that it's not spreading. So I have seen that several times where we have been anxious that it might spread. And then we test several people in the classroom and we've noticed that still, you know, we have minimal spread.
Jessup, you want to comment on that?
Sure. I agree with Christy. It's been pretty minimal both years. With Lubbock ISD, we do have a lot of contact tracers that we go through. If there's a positive case in a classroom, we go through and, you know, determine any close contacts, and we'll contact parents and things like that. But we haven't had many outbreaks at all. Just isolated cases here and there. So I think that it's a pretty good job controlling the spread in schools. A lot of the spread comes after school, especially, you know, in high school students when they hang out with their friends after school and things like that. But as far as in the school, in the classroom, it's been pretty controlled.
Thanks, Jessup. Hannah, you want to add anything to that?
Yeah, just comparing both years, I haven't seen a whole lot of spread within the classrooms. It's been very minimal both years. Like Jessup said, it's been more outside of school. It's been in the home because, you know, you're with your family, you're snuggling up to your kids, and, you know, so those close contacts at home have been more of the reason versus in class learning. District-wide, we haven't seen a large spread, and we just have enhanced cleanings. Every time we have an exposure, a positive case, we disinfect the classrooms, not only throughout the day, but we have just higher disinfecting process after school for our schools. Every day they're cleaned constantly, and we're just constantly, if we do have a positive kiddo, we're notifying parents in a timely manner to let them know so they can quickly monitor their child for symptoms and signs.
I appreciate y'all's insight. Thanks.
Thank you,
Sarah.
Sarah. Now we move on to Olga Guerrero with El Editor.
Buenas tardes. Good afternoon to y'all. Thank y'all for doing this for us. It was very informative, and I believe it's going to be very beneficial to everybody, especially the parents. And my questions are pertaining to the booster, the shots, and then we can't forget about the flu season shot already, you know. So I know that you can get the flu shot at the same time that you get your vaccination, one in each arm. But as for the booster, could you tell us, Catherine, can you mix and match like Moderna with Pfizer, or Pfizer needs to stay with Pfizer?
Very good question. The guidelines are that you should stay with the same brand. So if you receive Moderna, we're not looking at boosters yet, go get your flu shot. If you receive the Pfizer and you fall in those categories, we really want you to get that booster and also get that flu shot at the same time.
Thank you. The last question is, within the school systems, could y'all say that y'all encourage y'all staff within your co-workers and maybe parents? I can see where y'all wouldn't really say much to the parents, but as for yourselves within the school system, do you find yourselves needing to do that? Or would that be a good recommendation?
Let's see, Hannah, you want to go first?
Are you asking if the recommendation like for staff to get the booster shot necessarily?
The vaccine first.
Just the vaccine.
Vaccinated.
Okay. I know Friendship district-wide has left that just available for the staff. They have given us a lot of information on where to get the vaccines for over a year now, but they have left that as an option. It's not mandated for the staff to get the vaccine or the students district-wide, but they have given lots of resources to us that if we do want that vaccine, we have tons of resources through our human resources department. They've been wonderful in helping us get us information of where we can go get that vaccine for the last couple of years. So they've done a great job to make it available for our district.
Okay, and how about Jessup? We'll let you finish that one up. I think that we've picked on Christy a little probably more than we need to. So,
So I agree with Hannah. We, as a district, it's not mandated for Lubbock ISD. It is, Catherine and the health department has worked with LISD to give plenty of opportunities for the staff that do want to get it. We provide education. There's plenty of pop-up clinics and plenty of times initially when we were at the Civic Center that teachers and staff had the opportunity to go get the vaccine if they wanted to. But I encourage it for everyone, but it is not required.
Thank you very much. Thank you for everything y'all do. God bless.
Thanks, Olga.
Thank you, Olga. Thank you to everyone who joined us today. Thank you to our interpreter, and thank you so much to our panelists for offering their insights today. We'll see you hopefully maybe in 2 weeks.